Dr. Caitlin, and today we'll be reviewing a case of childhood bipolar disorder. This disorder occurs in children between the ages of 5 to 12. You will be learning about its symptoms and diagnostic criteria, prevalence and incidence rate, causal factors, and treatment plan. Let's take a look at a case of a mother and her son who seems to be diagnosed with childhood bipolar disorder.
Hey Patrick, what you doing, sweetie?
I'm playing.
What are you playing?
Mom, nothing. Just leave me alone.
Okay, well, I just wanted to bring you your pillow. It's fair.
No, Mom, I just want to play right now. Come on.
Okay, Patrick. Patrick, I'm talking to you. Listen to me. You're being very rude.
Go away. No.
Patrick,
No.
I was just gonna bring you your
I don't
pillow.
want this toy.
Patrick.
Ugh. No, Mom. Come on. Leave me alone.
Hi, Patrick.
Hi, Angela. How have you been?
Good. What's wrong?
I don't know. I'm just a little worried about my Patrick. He's just been sad. You know, last week was his birthday, and he was very excited, and he was bouncing off the walls. And now, come this week, it's completely different.
What's wrong, honey? You want an ice cream?
No.
What? He always loves ice cream. What's wrong with him? He's in really depressed.
I don't know. He's just... I really don't know what's going on. I mean, he's not eating as well as he used to. So we do have an appointment with his pediatrician. But other than that, there hasn't been any changes at home. I wouldn't know why he's acting like this.
I can recommend to my friend. She's a doctor. You can make an appointment anytime you want. I'll give you her card because you have to take him to the doctor. This is not right.
Okay, my name is Taylor, or Dr. Taylor. I'm a pediatrician here. And what's your name?
Well, my name's Ayuki.
And what brings you here?
I am here to talk about my Patrick. So he's 7 years old, and we've been noticing some odd behaviors in him.
Okay. What kind of odd behaviors?
Well, he just seems to be very upset and just very irritated.
Okay, is he irritated constantly at other kids, at his toys? Is it everything?
Yeah, I would say just last night he was very mad and he started throwing his toys around for no apparent reason. And then the afternoon before that, his teacher did make a phone call and she said that he was very rude to her and he was screaming at the other kids. So I would say just irritated in general.
Okay. So what you're telling me, it kind of sounds like DMDD, which is disruptive mood dysregulation disorder, and it's a new disorder for children. But I think I'd need a little bit more information to make that diagnosis. So is there anything more you need to tell me?
Well, I did mention he gets irritated, but it's odd because it only happens, see, now that I think about it, a few weeks ago he just turned 7 and he was very excited about his birthday. He was bouncing off the walls and, I mean, he was hardly sleeping, but we thought it was because he was excited about his party. And then come after his party was when he felt very irritated, I want to say. But then again, we thought it was just because he was tired. Because it had been a long week for him.
Okay, well, I'm glad you said that because now it's kind of shifting away from DMDD and it sounds more like CBD, which is childhood bipolar disorder, which is much different than DMDD. So, but I will have to run a little bit more tests and I'll get back to you as soon as I can.
Okay, thank you. Hello, I'm Dr. Caitlin. Thank you for coming in today. How are you doing? Good. I'm Uyuki and this is my little Patrick. Hi, Patrick.
Hi.
And I heard Patrick was diagnosed with childhood bipolar disorder.
Yes, that's what we were told.
Okay, well, I'm here to go over a few treatment options with you. How does that sound?
I think we're ready.
Okay, the most common form of therapy is cognitive behavioral therapy. You can also try child and family focused therapy, and that's really beneficial because since Patrick is at such a crucial age in his development, it's very important to get the whole family involved in this. Okay. And therapy's the only option?
Well, the most effective form of treatment for childhood bipolar disorder is therapy combined with medication. And the two most common medications that are given to children are aripiprazole and risperidone. And those are both antipsychotic drugs and will help stabilize his moods.
Okay, so that's gonna help him when he's like very upset and then the next day he's crying and then the next day he's excited.
Correct. That'll help stabilize his moods and keep him at a steady mood level.
Okay. And then when does he get cured?
There is no cure for childhood bipolar disorder. However, early diagnosis and treatment can help stabilize Patrick's moods.
Okay. So I'm confused. With you saying that because he was diagnosed, this is something that will stay with him forever?
Yes, unfortunately that is so.
Okay, and because we will be doing therapy and medication, Patrick will be able to have a good childhood.
Correct.
Okay, I think we're on board. Patrick, how does that sound?
Okay.
Thank you for coming in. It was great meeting you.
Thank you.
Children with bipolar disorder experience unusually intense emotional states that occur in different periods. These mood changes can be accompanied by extreme changes in energy, activity, sleep, and behavior. Each mood episode must represent a drastic change from a person's unusual mood and behavior. A manic episode consists of an overly joyful or overexcited state. A depressive episode consists of an extremely sad or hopeless state. Sometimes a mood episode can include symptoms of both mania and depression. Because of the rapid mood changes and high energy are common among children, experts believe that overdiagnosis and mixed diagnosis may play a role in the increasing numbers of children being diagnosed with and treated for this disorder. For example, children with chronic severe irritability and symptoms of ADHD may be misdiagnosed as having bipolar disorder.
There's considerable controversy regarding the prevalence and incidence rate of CBD. Since there is a wide range of childhood behavior, it is difficult for parents to determine abnormal behavior and possible indications of bipolar disorder. This disorder easily overlaps with other childhood onset disorders, so it is difficult to disentangle symptoms and determine a correct prevalence. In particular, comorbidity between children with ADHD and CBD is extremely high. However, studies suggest that CBD has a lifetime prevalence rate of approximately 1 to 1.5% of the population.
Genetic heritability, abnormal brain structure, and environmental factors are the three main causes of CBD. First off, CBD is highly heritable. Children living with a bipolar parent are 4 times more likely to develop a mood disorder than children of parents without psychiatric illness. Secondly, structural and functional neuroimaging studies suggest that abnormal brain structure is also a causal factor of bipolar disorder in children. There is a reduction in size of the amygdala in children with CBD. Lastly, environmental factors play a key role in the development of CBD. Abuse, mental stress, or some traumatic event are important contributors to psychiatric disorders in children, while childhood physical abuse seems to be the strongest predictor of bipolar disorder.
The most effective form of immediate treatment for childhood bipolar disorder is medication in order to stabilize the child's mood and reduce symptoms. However, due to risk of impaired development, there is not much research surrounding proper pharmacological treatment. Pharmacology can sometimes be an effective method in treating or suppressing symptoms of CBD, yet it does not fully address the disorder itself or meaningfully solve the problems that come with it. For this reason, cognitive behavioral therapy and child and family focused therapy is often utilized. The draw on the benefit of child and family focused therapy is that it is a comprehensive form of treatment that addresses a problem not just affecting an individual but an entire family system. Treatment is designed to reduce stress and conflict and increase cohesion and communication in the family system. It is very much about uncovering the symptoms of the disorder and helping the family to identify and understand the triggers, causes, and the effects of behavior.
Thank you for watching. I hope you all now have a better understanding of childhood bipolar disorder.